Now, President Akufo-Addo, in his national address last Sunday on measures to check the spread of coronavirus in Ghana, made reference to a study by scientists at the West Africa Center for Cell Biology and Infectious Pathogens.
And an analysis of the active case data suggests that the Greater Accra region accounts for some 75%, with Ashanti, Bono, East, and Western being responsible for 16% of active cases. The remaining 11 regions make up 4% of the cases, with the rivals at Kotoka International Airport responsible for the other 5%. Scientists at the West African Center for Cell Biology of Infectious Pathogens at the University of Ghana, Legon, collaborating with the Noguchi Memorial Institute for Medical Research, who are studying the genetic makeup of the virus in Ghana, have established that the virus has not changed.
Well, that same study stated that though Ghana's COVID-19 case count is just about 50,000 cases, more than 1 million people in Greater Accra and Kasoa have been infected by SARS-CoV-2, the virus that causes COVID-19. For the researchers, the study provides evidence that COVID-19 was never in decline, as suggested by the new cases being reported daily by the Ghana Health Service. Now, another aspect of the survey has to do with the segment of the population most exposed to the virus. Dr. Yaw Bediako is a research fellow at WACCBIP, and he actually participated in this survey, or he was one of those who was involved in this survey. Thank you very much, Dr. Yaw Bediako, for making time to speak with us. Now, one of the interesting findings that you came up with is the fact that quite a number of people have been exposed to COVID-19 or SARS-CoV-2 in Greater Accra, in the Greater Accra region. You're looking at about 1.2 million people. Explain to us what exactly that means.
Thank you, Israel. So our study was basically based on the concept of sampling. So we actually tested about 1,300 people from a cross-section of people across Greater Accra region and Kasoa. So we visited lorry parks, we visited markets, malls, healthcare facilities. And basically what we found was about 19.6 or close to 20% of the individuals we sampled had antibodies to SARS-CoV-2, indicating that they had been infected in the past. And so when you extrapolate from that sample, if you say the Greater Accra region has roughly 5 to 6 million people, when you extrapolate that 20%, then you're looking at numbers around 1 to 1.2 million people. So that's how we arrived at that estimation. It is an estimation because it is impossible, it's impractical to test every single person in the Greater Accra region. But prevalence studies are based on taking a representative sample of a cross-section of the population and then extrapolating that data to make projections about prevalence in an area.
So the 1,300 people you say you sampled, did they indicate if they had ever had or tested positive for COVID-19?
Majority of them had never even had a COVID-19 test. A few of them who were health workers, frontline healthcare workers working in treatment facilities, of course, had access to a PCR test, and a few of them had been confirmed positive. So our test typically confirmed if an individual we interviewed had a positive PCR test in the past, typically we found that they had antibodies. But for the large majority, I would say well over 90% of the people we sampled had never had any form of COVID-19 test, which I think is quite typical of the general population in Ghana.
Right, which then also goes to, or is very much in line with the stats we're getting from COVID, that a majority of the people will be asymptomatic or mildly symptomatic, which would mean that they would have the virus, but they wouldn't show symptoms, and so they wouldn't be ill, and so they wouldn't need a test.
Yes, I think well over 90% of people globally who've had COVID-19 have been asymptomatic or mildly symptomatic. And that is why the strategy of testing, tracing, and treating is so important, because if you do not test, individuals, you do not typically detect the virus. And so, even locally, our government policy for a long time in the beginning was basically going out to try to test people regardless of whether they showed symptoms. So yes, majority of people who have had COVID-19 in Ghana will probably not have realized it, or if they did, they maybe had, mild cold-like symptoms and just, powered through. But the issue is, because of that, it makes detecting infected people challenging. And of course, these people, once infected, can spread to other people who may not fare as well as they did, based on perhaps underlying conditions, the age of the individual who gets infected. So that's what makes COVID-19 so difficult to control, because a large majority of people who have the disease do not show any signs or symptoms.
Right. Now, another thing I found out in the survey that you put out, the research that you put out, is that there was a particular segment of the population, or there's some particular segment of the population that are most at risk. Please explain that to us.
Okay, so as I said, the purpose of the study was really to get an idea of the true burden of disease in Greater Accra Region and Kasoa. Because, as I said previously, without testing everybody, it's very difficult to get a clear idea, because, if you only test a very small proportion and you stick you peg your numbers at confirmed cases, you are typically underestimating severely the number of cases, because so many people don't have symptoms. So by doing this prevalence study, the idea was to get a sense of how, what the burden really was, and to make it representative, we tried as best as possible not to just sample a single demographic. So we tried to sample people from different socioeconomic classes, different occupations, different work environments, to try to get a sense of what COVID in Greater Accra really looked like. Now, what that allowed us to do also was to then segment our data and compare the risk profiles between individuals with different socioeconomic standing, different levels of education. And what we found was, overwhelmingly, people in the informal sector, people with a primary education or less, and people who were in lower socioeconomic classes, typically were more at risk. Their risk of being positive for antibodies and therefore having previously been infected was significantly higher than individuals who worked in more formal settings, individuals who had higher income or higher levels of education. And I think this goes to demonstrate that whereas in the very beginning, COVID was viewed as a disease of people in East Legon and Jolu, people who had the means to travel, because originally cases that came into Ghana were by airplane. So if you couldn't afford a plane ticket and go to Europe or Asia, you were not at risk. Once the virus entered the country and began to spread within the community, very quickly it transformed into what we typically see with outbreaks and pandemics of this type, that it tends to, impact people who are in lower socioeconomic classes, people who live in more crowded settings, who work in more crowded settings, who take public transport to work as opposed to driving their own car. These are all things that make people more likely to come into contact with a contagious disease. And so now our data demonstrates that the disease is no more the disease of the relatively affluent in the affluent parts of Accra, but is now circulating very freely among people who are in the informal sector and who have less means, in fact, to deal with such a virus.
In other words, it would then mean that the people who are in those less affluent segments of the population would have to take better care of themselves. Or if they did that, then they'll be better insulated or better protected.
Yes, I think we all have to take very good care of ourselves regardless of our socioeconomic bracket. But certainly, if you live in a compound house with 15 to 20 other people sharing maybe a common kitchen and a bathroom, versus living in an apartment or a single family home where you're just with your immediate family of 4 or 5, certainly wearing a face mask, those living in a flat or in a single family home may not need to wear a face mask during the evenings when they're home, because, they're just with very close family. versus if you live in a compound house with 15 or 20 people, now your risk profile is significantly greater because each of those people has gone to work, has taken trotro, and so you have no idea what is really circulating in your home. And the same applies to public transport. There are certain people who never take a trotro because they have their own car, they drive to work in air-conditioned environment, they go sit in an office, and then they go back home. Versus people who have to go queue at a lorry park, get into a crowded trotro in the middle of the day, twice a day, going to work and coming back. All of that puts you at much greater risk. So yes, you talk about mask wearing. If you're in your car on your own, there's no need to wear a mask. But if you're in a crowded trotro, absolutely you need to be wearing a mask. So yes, people, based on our data, it suggests that people who take public transportation, who are in lower socioeconomic classes or work in the informal sector, are the ones who absolutely must be adhering to the guidelines as much as possible to protect themselves.
Now, Dr. Bediako, have you and your colleagues at WACCBIP been able to establish why we're seeing the recent surge in the COVID-19 cases?
It's difficult for anyone to pinpoint specifically the reason. I mean, I think a lot more work will have to be done.
There have been suggestions that it has to do with the uptake in political campaigning or political activity, but the information minister doesn't think that could be, that claim holds.
I think any gathering that aggregates people is bound to cause more spread. We've seen this around the world. We saw it in the UK when pubs opened, people were going out, all of a sudden their cases go up, and now they're in the middle of their second national lockdown. In Ghana, we've seen a gradual easing of restrictions. We've seen a gradual laxing in personal discipline. Individuals, I think the president himself mentioned that mask wearing had fallen to 5%. And yes, if you look around, there are political gatherings, there are funerals, there are weddings, there are all kinds of events taking place where large numbers of people are aggregating. There are health walks, which in this day and age befuddles me because, what is more healthy than protecting yourself? So all of these activities, whether they are politically motivated or not, are aggregating people. And these are all ways in which this virus is spread. This is not rocket science. This is something that has been demonstrated all over the world. When you aggregate large numbers of people, they call them basically super spreader events. You have, we've seen them even in the US at the White House when they had a large gathering and several of President Trump's staff tested positive shortly thereafter. So I think our uptick in cases is tied directly, and I find it, I don't think anyone can really argue this. Our uptick in cases is tied directly to the fact that we are seeing larger and larger gatherings, as well as less and less adherence to the COVID-19 protocols, hand washing and face mask wearing. So when you couple lack of adherence to the guidelines with greater aggregation of people, whether it is in rallies or in funerals or in weddings, that is a perfect storm to have COVID-19 continue to spread.
Right. Now, one final thing that I'd like to draw attention to. You're one of those who has always been speaking about the COVID-19 test, antigen test that we're conducting at the airport. And you're saying that it's not as effective as the PCR. So could it be that the tests we're conducting at the airport are unable to actually detect all the COVID-19 cases that are coming through the airport, to the extent that some of them slip through the system, so that if they're slipping into the system and coming into the country, these people will be infecting others? Is that also a possibility?
Well, an antigen test is not as sensitive as a PCR test. There's no scientist in the world who will tell you different. So certainly, the antigen test at the airport is not as sensitive as PCR. Having said that, PCR tests take longer and are more expensive. And so there is that consideration. To be honest, I don't think our uptick in cases is due to a sudden influx of COVID-19 from abroad. That is partly because our guidelines require that people entering the country have a negative PCR test taken no more than 3 days before they travel, in addition to the antigen test. And we have picked up a few people, I think over 100 people who were positive when they came in. So while yes, it is possible, it is certainly possible we've missed a few. I don't think those that have been missed would be responsible for the uptick. I think, our sequencing data, which the president alluded to in his address, demonstrates that there are certain, yes, in general, the virus is very similar to what is in China. That is what has been reported globally. The virus does not mutate too quickly. But we did find, certain variants in our Ghanaian samples that had not been reported anywhere else. Now, that is not necessarily cause for concern in terms of, the virus becoming more virulent. At least there's no evidence of that yet. However, what it does provide evidence for is that the virus is spreading freely within our community. Because for the virus to mutate, it needs to be transmitted. And so the fact that the virus, we have certain unique variants locally, suggests that the virus is moving freely. And if indeed all the uptick in cases was imported COVID, then certainly the viruses that we find in Ghana would be almost identical to what, would be completely identical to what what has been reported elsewhere. So I think we probably do not have to worry as much. I think there is enough COVID in Ghana that actually whatever is coming in through across our borders is negligible. If you look at the US, they don't bother even testing when people come in because they recognize how much COVID they have locally. They are testing well over 100,000 people a day and are reporting close to 100,000 new cases every day. Now, I'm hopeful that we are perhaps not quite as we don't have quite as high the caseload as they have in the US. But I think we can rest assured that even if a few are slipping through the airport, that is not where our problem lies. Our problem is domestic. COVID is now a Ghanaian problem. It's not just being imported. And we need to focus, all our efforts really need to be focused on preventing community spread, preventing local transmission. That is where the danger is. It's not some imported disease that we can blame, people traveling on. It is, whatever COVID we have in Ghana is now a local COVID, and we need to prevent the spread by adhering to the guidelines locally. It's not about the airport.
All right, thank you very much, Dr. Yao Bediako. Dr. Yao Bediako is an immunologist and is with the West Africa Center for Cell Biology and Infectious Pathogens.